Hello, everyone. Today's video is all about the skull. So we are going to get started with the screen share. I have only my skull in the screen right now. We're going to talk all about the skull and the bony landmarks of the skull. There are quite a few. As you might have recalled from your reading, there are 14 facial bones, but 22 bones in the skull altogether. So most of the skull bones are in the face. And there are a lot of bony landmarks here that we are going to put some muscles on very shortly. First of all, let's just take a look at the skull. I do have a skull right here. Unfortunately, because I don't have any way of holding it together, it articulates like this. It won't stay together. So, so it doesn't have the top here like this, and the mandible falls off. So I can point some things out, but I like this a little better because it stays together. So here we go. This is an image, of course, of the skull, and you can see that there are lines where the bones come together, right? Who remembers what these lines are called? Yes, that is correct. They are sutures. Unlike synovial joints, these fibrocartilaginous joints of the sutures are not freely movable. That's not to say that they don't have any movement at all, because they do. It's just very, very slight. These sutures come together like this, right? Like a squiggly line. This is a good example. Like a squiggly line here. They come together like this. And the movement that they produce is more of a beveling kind of movement, a little bit of out and in, but that is it. That's the only movement that occurs at these joints, the sutures. Now, you will have to know the names of the sutures. None of them, of course, are listed here at the moment, but we'll talk about them when we talk about the different bones that are here and which sutures connect the two. Okay. So in your book, it begins with an anterior view of the skull. And here we are. And I like how they have colored each of the different bones so you can actually see the separations between them. When you look at a skull like this, it's not always easy to distinguish where one bone ends and another begins, especially when we get to the small bones inside the eye orbit. But in your book, they have made it easy. So let's begin with the anterior bones. So the one right here is the frontal bone. The frontal bone is basically your entire forehead and the top of your eye orbit here. Pardon me. Okay. And then it does extend back into the side of the head a little bit. And here is the suture you see on the screen that connects the frontal bone to these two bones right here. This suture is the coronal suture, which you may have remembered from way back in the beginning when we were talking about med terms and the meanings of things, and we were talking about planes, right? Remember, the coronal plane divides the body into front and back portions. The coronal plane, of course, is named for the word corona, which means crown. And of course, this is the coronal suture because you would sit a crown right here, right along that coronal suture, okay? Now, it doesn't have another name, it just is coronal suture. Okay, so this is the frontal bone. Now, as we move down into the face, we have the nasal bone. That's this one right here, the one upon which my glasses are sitting at the moment. Okay, that's my nasal bone. It is not very big. The rest of this area here is filled out by cartilage, which is a different kind of cartilage than that which the sutures are made up of. And it's a different kind of cartilage than the cartilage that attaches to your ribs. This is more of a squishy kind of cartilage, a more mobile kind of cartilage. So this is the nasal bone. Now, deep within the nostrils here, right in there, you see that? That bone right in there. I'm going to use this to point to it. This is one of my paintbrushes here. Right in there. That is the vomer. So the nasal bone is this, right? And even on the sides a little bit. This piece that separates the two nasal cavities is the vomer. V-O-M-E-R. That's the vomer right there. Okay. Now, even these right here have names. Technically, they are part of the nasal bone. However, they are called nasal conchae. C-O-N-C-H-A-E, nasal conchae. And even though it doesn't look like it in this image, let me see if I can show you in this one. Yeah. See how the nasal conchae come down and curl around a little bit there and there. And you can see the little curlies right here and here. See, and then up here and up here on either side. There are 4 of them there. The nasal conchae they serve a specific purpose within the nasal cavity. They're covered by membrane, as everything in the nasal cavity is, and they help to warm and moisten incoming air, so inspired air. Whenever you breathe in through your nose, air gets caught in the little nasal conchae and it is warmed and moistened before it hits your lungs. So they're basically little nose humidifiers, which I think is really cool. Okay, moving on. We have the maxilla. This is the maxilla right here. It forms your upper jaw. Okay, so the top part of this here and part of your cheekbone. Okay, the medial part of your cheekbone. That's the maxilla. Of course, if we move inferior, we have the mandible. This is the mandible. Okay, and we do have bony landmarks on the mandible as well. I will get to those a little bit later. But right now, we're just going to talk about the mandible as a whole. As you can see, it is a rather large bone and it articulates at these points right here with the skull. There we go, right there in the joint. And if it would stay together, I could, oh, there we go, I can kind of make it move. So it articulates right here with the skull. Okay, now we have some other bones within the face itself. We have these zygomatic bones. Of course, they're on either side. The zygomatic bones form the rest of your cheekbone. So what you think of as the cheekbone usually is your zygomatic bone. The zygomatic bone actually goes all the way around here, and then articulates with the temporal bone. But if I turn it this way, you can see that there is a hole straight through that. Can you see that? Stick my finger through that right there. That's not a foramen or anything like that. It's just a space that's formed by this zygomatic bone as it makes its way over to the temporal bone here. You do have muscle that's going to come down through here and fill this out. But this is the zygomatic bone, and this is the zygomatic arch, which it looks very much like an arch, as you can see. This is the zygomatic arch right here. All right, now within the eye orbit, you have a couple of very small bones. So you have the frontal bone you have the maxilla, you have the zygomatic bone. That makes up most of the external eye orbit. And then the internal orbit is made up of smaller bones. The one that's closest to the exterior is the lacrimal bone, this one right here. The lacrimal bone is just deep to your tear ducts. So if you're familiar with your tear ducts, which you should be, because I'm sure everyone that is watching this video has cried in their lifetime, the lacrimal bone sits deep to those. Okay, your tear ducts are your lacrimal ducts, and the lacrimal bone is deep to that. Posterior to the lacrimal bone, you have another small little bone. It's called the ethmoid. The ethmoid obviously is not going to be palpable. The lacrimal bone really isn't either, but they are going to be deep in here, inside the eye orbit. And then if you look through, you can see that there's another bone back here that you can see the outline of it. It makes a V shape, right? Or less than sign, right? Well, the bone that actually makes that shape in there is called the sphenoid. Now, the sphenoid bone is a very unique shaped bone, and it actually goes all the way through the skull. So if I show you this image of a skull, so I took, obviously the top is off, and we're looking down in the skull, this is all the sphenoid. Okay, not this back here, but this across here is all the sphenoid. So it has a lot of different parts and a lot of different landmarks, and you can see the sphenoid through the eye orbit here. Okay. Now, if we add them all up, of course, you have 14 facial bones, and that includes those nasal concha. Conchae is plural. 2 lacrimal, 1 mandible. You only have 1 mandible. You're not an ant that has multiple mandibles. Maxilla, 2, right? 1 on either side. 2 nasal bones, 1 on either side. 2 palatine bones, which you cannot see yet. We'll have to look at an inferior view of the skull. 1 vomer and 2 zygomatics. Those make up the 14 facial bones. Okay, so if we turn the skull around, we can see the rest of this. So we already talked about the frontal bone and the coronal suture. Now we are back here. So we're looking at it like this. We've turned the skull around. We can see these 2 bones here, and we can see this bone right here. 2 bones on the top and sides of the head here are the parietal bones. Sorry, I almost said palatine. Parietal bones here and here, and they are separated right where my part is by the sagittal suture. Again, you're probably already familiar with this because we talked about it back in the beginning. We have the sagittal plane, specifically the mid-sagittal plane, goes right down through the sagittal suture. So you have the parietal bones on either side, and then in the very posterior of the skull, you have the occiput. The occiput, there's only one, just like there's only 1 frontal bone. The occiput is the whole back of the skull. So we've already talked about some of the landmarks on the occiput. We've talked about the external occipital protuberance, which is right here, the superior nuchal lines here and here, the inferior nuchal lines, which are here and here. Okay, so we already are familiar with the occiput, really. Now, the occiput is separated from the parietal bones by the lambdoid suture. Lambdoid suture. And this is a really nice example of a suture. You can see how it fits together like a zipper almost. Okay. Now, if we turn, whoops. I was going to turn it around and I can't because this isn't 3D. Okay. So we have the maxilla that we can see from this view, and we also have the mandible that we can see from this view because, of course, we've taken the vertebrae completely out here. This is just the skull. If we added the vertebrae, they would start here and go down here. You wouldn't really be able to see all of this because the vertebrae would be in the way. One of the bones that we haven't talked about yet is the temporal bone. So I'm going to switch over views here. And if we turn the skull this way, right, this is the frontal bone. This is the parietal bone. This is the occiput. So what we have here is the temporal bone. And the temporal bone is separated from the occiput and the parietal bones. And this is the sphenoid. So here's another place where we can see the sphenoid. The parietal bone is separated from all of those by the squamous suture. So this suture right here is called the squamous suture. Okay. And the temporal bone itself has some really nice landmarks. So we'll get to those in just a moment, but you can see one of them is right here and one of them is right there. Oops, wrong one, sorry. Okay. So if we turn the page, we're on page 229. Now we can see the temporal bone very nicely. Okay. And obviously this is pointing out all the landmarks that are here, which is kind of nice. You have to match up the letter though, obviously, because it would be very difficult to actually write the landmarks in. So here's the temporal bone, letter C. Letter E, of course, is the sphenoid again. Remember, we said it goes all the way through right here, and you can pick it out on the side here. And then, of course, it's all in through here. So on the temporal bone, we have the external auditory meatus. It looks like meatus. See this word right here? Meatus. It's not, it's meatus. And the external auditory meatus is your ear canal. Okay, you can't actually touch it. This is all external to the external auditory meatus, all of this here. But your ear canal, in which your tympanic membrane sits, is right here. So it's part of the temporal bone. A meatus, for those of you who like definitions, is a tube-like passageway within a bone. Tube-like passageway within a bone. And that's exactly what this is. It's very meatus-y. All right, we also have this landmark right here. Point that out here. You see that? This is the mastoid process of the temporal bone. Now, we've already had muscles that attach to the mastoid process of the temporal bone. Can anyone think of at least one? Yes, the erector spinae group, right? We had one that attached way up here at the mastoid process of the temporal bone. And again, it is just posterior to your ear here. You can feel it very easily on everybody, right? This little one right here is the styloid process of the temporal bone. And I'll show you that real quick. It's this one right here. Let me get this a little closer. This right here is the styloid process of the temporal bone. They're pretty pointy. You can see in any view, like there. They are rather sharp, but they do act as a muscle attachment site, which we'll talk about when we get to the muscles. Okay. So you have quite a few landmarks just on the temporal bone. You even have the zygomatic arch here. All right. So I is the zygomatic bone, and then this U is the zygomatic arch. It is actually made up of zygomatic bone and temporal bone. Okay. So it's both. The arch is both. All right, if we move into the mandible specifically, we have some landmarks, as I mentioned. We have this lovely piece right here. which is the ramus of the mandible. And we have this lovely piece right here, this point here, which is the coronoid process of the mandible. See, there's another coronoid process. Isn't that great? A coronoid process of the mandible. So now we have to be specific. We can't just say coronoid process because we have others. Coronoid process of the mandible. This is the articular surface of the mandible. Okay. And this is technically the condyle of the mandible. If we put the condyle of the mandible together with the temporal bone, fits in right here, see that? This is the temporomandibular joint, otherwise known as TMJ. Okay, so the condyle of the mandible fits into the temporal bone of the skull, and it is the temporomandibular joint. And you can see this is nice and smooth, so you know this is going to be an articular surface. There's going to be cartilage here. Okay. All right. A couple other things that we see here, just to kind of get your bearings. We do have this bone right here. It is a floating bone, and it is called the hyoid bone. It is up here, just below your mandible, but above your Adam's apple. Okay, so this is cartilage that begins the trachea. This is your thyroid cartilage, and this is the cricoid cartilage. Your thyroid cartilage is your Adam's apple. And just above that, you have the hyoid bone. Now, the hyoid bone is truly a floating bone. It does not articulate with any other bones at all. It sits in here and is only held in place with connective tissue and some cartilage. So it is not a bone that articulates with any other bone. So it doesn't have any articular surfaces. It's right here. You can move it back and forth, which is super weird to do. Okay. I mean, I wouldn't recommend it. It feels awkward and weird, but you can. And the hyoid bone helps attach muscles that move the mandible into depression, and also helps move the trachea out of the way for swallowing. So we'll talk about that in a little while. But I just want you to know that it's here, and it is a floating bone. Okay, so one more image here. We have a couple more landmarks that we need to talk about, but first, this bone right here, that's the palatine bone, okay? We were not able to see it, here it is, palatine, there's the word, P-A-L-A-T-I-N-E. We were not able to see it in any of the other views because we needed to turn the skull upside down. So we have the maxilla, and then posterior to that, we have the palatine bone. You may be familiar with that area because up in the back of your mouth, on the roof of your mouth, you have a soft palate. It's that squishy little bit that kind of flaps around when you swallow, okay? And it's soft tissue, but it is where the palatine bone is, okay? And as you can see, there's a line that goes down through there because when you're forming in utero, these two sides come together and connect. Sometimes, though, that is incomplete and you end up with a hole right through here. So it doesn't close all the way, and that is called a cleft palate. It can be very minor, or it can be quite severe. If it's severe, then of course you are going to need surgery because you won't be able to eat properly. When you swallow, things will go up into your nasal cavity instead of back down into your throat. So the palatine bone is this little one right here, okay? All right, so what else do we have here? Well, here's the maxilla, again, zygomatic bone is this blue. This is the sphenoid, this green here. Okay, that's all sphenoid. The red is the temporal bone, and H is actually the mastoid process of the temporal bone. So you're kind of looking at everything like this. Well, you're looking at it like this, but if you turn it this way, you'll see the mastoid process is sticking up. G here is the bottom of the vomer, which is kind of wild because it looks so small when you're looking at it through the nostrils, but it actually has a bigger base to it. So that's the vomer, the base of the vomer. Now, you have a big old hole in your head. See? Big hole in your head. That is a foramen, and that is called the foramen magnum. And here's the word right here, foramen magnum, which means big hole. This big hole in your head obviously has a purpose. It is where the brain stem becomes the spinal cord. And then, of course, the spinal cord is going to go all the way down through the intervertebral foramen, and then, down through the spine until, of course, it becomes the cauda equina. Okay. So this is a really important thing to have here. You do have to have your brain connecting to your spinal cord at some point. It is generally considered good. Way back here is the EOP, and then the superior nuchal lines are K. All right. So let's go back here. We can see all of our lovely parts. Now, one thing that you may have noticed, whoa, Nelly, are these little holes here and here. And you also have them here and here. These are foramen. They are for blood vessels and nerves to pass through the bone. And these are your suborbital foramen. Imagine that, they're below the orbit here. So they are the suborbital foramen. And these down here on your mandible are the mental foramen. They're called mental foramen. Okay. And right here is where the two maxilla bones come together. And if you go through there, let's see if I can flip them upside down. There we go. Go through there. Whoa, Nelly. Let's make them smaller. There we go. So here's that line again. And right here is the hard palate. And right here is the palatine bone again. Okay. It's much smaller than it looks. And that's part of the sphenoid. And then this little bit right in the middle there, that's the vomer. Okay, so that gives you, I kind of like this. This gives you a better view of the sphenoid now that I can just color the sphenoid. And you can see exactly how it sits in the skull itself. The sphenoid actually looks like a butterfly. If you look at it through the skull, right? Do you see that? It looks like a butterfly. And in fact, you actually have landmarks on the sphenoid called the greater wing of the sphenoid. I can't get my cursor back. I don't know what happened. Ah, there we are. Here's the greater wing of the sphenoid. And then here's the lesser wing of the sphenoid. You see that? So yes, it does very much look like a butterfly. I'm going to take a look here. We're going to hide that, hide that, hide that. And then there's the sphenoid again. See? There it is. Now that's kind of a weird view. Okay. That's okay. So that's the sphenoid. Now, the sphenoid itself has this little bit right here. Let me turn it on its side a little. Do you see that? You see how it makes a little dip right here? This landmark is called the sella turcica. S-E-L-L-A-T-U-R-C-A. No, Turcica. T-U-R-S-I-C-A. There we go. Selaturcica. I don't know if that's in your book anywhere soon or not. I don't think it is. The Selaturcica is called the Turkish saddle. That's where the name comes from. And this little bit of bone, this little indentation of bone here, actually holds your pituitary gland, which of course is part of your brain. So the pituitary gland sits right here, and it's so vital to your functioning that it has its own bony protection, and that is part of the sphenoid. So I do want you to know what the Selaturcica is, pardon me, and I want you to know to which bone it belongs. You don't need to know about the pituitary gland just yet. That'll come back in physiology. Okay. Selaturcica is the landmark there. All right, last thing we want to talk about is the mandible. So we already mentioned the coronoid process of the mandible. We mentioned the condyle of the mandible. I told you that this part right here is the ramus of the mandible. But then you also have the angle of the mandible, which is right here. And then this is the body of the mandible. Okay, this is considered the body of the mandible. If you go in to the mandible, so we're inside where the tongue would be, this is the submandibular fossa. We do have attachment here, so I have to mention this landmark, the submandibular fossa. Okay. But that's all you need to know here, just those few landmarks that are listed on page 230. All right, so now I would like you to study the bones of the skull and know them pretty well, know the landmarks also, before you move on to the muscles, because when we go into the muscles, of course, we're going to be talking about attaching them to certain landmarks, and it is helpful to know where those landmarks are. Okay, everybody. Talk to you soon.